Hello and welcome everyone to today's WorkSafe Tasmania month webinar, Healthcare and Workers' Compensation. I'm Stephanie from WorkSafe Tasmania. WorkSafe Tasmania month is an initiative funded by the WorkCover Tasmania Board. Before we start, please take a moment to read the following slide about information received today. To interact in today's webinar, please use your control panel to type and submit your questions for today's presenters. Questions will be collected and answered at the end of the webinar. Today's webinar is also being recorded and will be made available on the WorkSafe Tasmania website at the end of WorkSafe month. I would now like to introduce your presenters, Cass Frey from Honeysuckle Health and Simone Guys from QBE. Cass leads the client growth strategy for Honeysuckle Health Group, collaborating with clients and working across the Honeysuckle Health business to deliver products and services to meet clients and customer needs. Cass is passionate about creating exceptional customer experiences, delivering value to clients, and fostering a culture of innovation and collaboration to support the adoption of value-based healthcare. Simone joined QBE in 2013 as a case manager in QBE's Workers' Compensation Department. Simone has worked in QBE as an Injury Management Advisor, Healthcare Manager WA, and Healthcare Implementation Manager People Risk Claims. Before joining QBE, Simone was an exercise psychologist working with Curtin University, the University of WA, and the Cancer Council WA. Simone's passion has always been about helping people, initially through exercise prescription and now focusing on the broader community through a higher level. Welcome, Cass and Simone.
Thanks, Stephanie.
Thanks, Stephanie. Hello, everyone. Great to be here with you today. I'd actually like to begin today with an acknowledgement of country. So, as Stephanie said, my name is Simone, and I'm the daughter of English, Irish, and Scottish immigrants, and I call Australia home. I'd like to recognise the traditional people of the continent whose land was stolen nearly 250 years ago. I'd like to acknowledge that I'm hosting this webinar from the lands of the Noongar people in the southwest of Western Australia. And I would also acknowledge the traditional custodians of the various lands on which you all work on today. I pay my respect to the elders, both past and present, and would like to extend this respect to all Aboriginal and Torres Strait Islander people joining us today. So Cass and I are here to talk about something today that affects all of us, and that's healthcare. And in particular, we'd like to share how innovation is changing the provision of healthcare in compensation schemes. If you think about it, the world of healthcare is changing faster than ever. We're seeing incredible technology advancements, ageing population, and evolving expectation from both patients and providers. So the old ways of doing things just aren't cutting it anymore. As an insurer, we recognise that we have a valuable role to play in providing the injured person, the people that we support, with the best care possible. To achieve this, we've embraced innovation, and that's what's helping us to deliver on our vision to enable a more resilient future for customers and partners. In QBE's people risk business, which is our workers' compensation and CTP accident schemes, we bring this to life by being the best at helping people bring their lives back together following an injury, by being good people supported by science and analytics. Now, our people risk statement is actually not new for us. It was actually brought about into our business around 6 years ago that it was first introduced. And whilst there's strength in these words, what really matters to us most is that we deliver on it. So when we asked ourselves how, it was obvious we couldn't do it alone. And that's when we started partnering with experts in our community to bring to life innovative ideas. Over the last 5 years, we've carefully designed solutions to specific problems that we've faced in our claims, programs to support things like appropriate medication use, access to motion video detection technology to speed up recovery, personalised video technology to understand psychosocial responses to injury, are just a few examples of what we've been working on. We've seen some really positive outcomes through these programs, and they each gave us some confidence that with the right partners, As an insurance company, we could be more directly involved in the care pathways for injured people, and it would improve recovery outcomes. One challenge, though, that we didn't anticipate was by having quite a few bespoke programs solving different problems, we still weren't effectively addressing the overall healthcare experience for injured people. So we went back and asked ourselves a bit more, and we kept coming back to the challenge that we've all faced for many years. People who are injured at work have a much greater chance at a worse outcome compared to the same injuries in non-compensable settings. We have a system that is centred around helping people to recover from injury, but we appear to be having the opposite effect. So the question is why? Well, we've observed that in most cases when we see adverse claims outcomes, it's often the result of poor quality healthcare provision in the beginning of the claim, and it's difficult for us to recover from there. So when we considered, okay, look, the provision of healthcare in our industry, how is that looking? What is it really, nutting it down to? And we identified 4 problems that we think we continue to face. Firstly, we do want to acknowledge that there are some excellent providers working in our scheme. We've got a number of partners that do some wonderful work with us, but we still do too often see injured people finding themselves in the care of providers who do not adhere to evidence-based guidelines for treatment. And this can lead to suboptimal outcomes, prolonged recovery times, and exacerbation of injuries. If injured people are treated by practitioners who don't deliver the best care, it can result in unfavourable outcomes. Identifying and addressing this issue is crucial to ensure that injured people receive care from professionals who deliver value-based care and are committed to positive outcomes. Another critical issue is the lack of effective communication and coordination among the various parties involved in the care. When healthcare providers, employers, insurers and injured people don't work together seamlessly, it leads to fragmented experiences, misunderstandings and delays in treatment. And lastly, we found that injured people continue to face hurdles and delays when accessing the necessary healthcare services, and they're often ill-equipped to navigate the healthcare system on their own. Timely treatment is crucial, and each delay can have a detrimental impact on their recovery. So what these observations highlighted to us was the need for improved healthcare navigation and early support is clearly heightened within compensable injury schemes, and we needed to look at a new way to help people recover from injury most effectively. So this is when we shifted our focus towards getting high quality healthcare provision in place from the beginning, so that people would recover sooner and the financial aspect of what we do as an insurance company would take care of itself. To do this, we decided to try a new approach and become even more directly involved in providing pathways to better healthcare for people. Our solution centres around the concept of value-based care, which we see as a significant shift for our industry. It places a strong emphasis on evaluating the outcomes of the individual, as well as measuring their overall healthcare experience in our scheme. The good news, this isn't just a concept to us. We've been working with external partners to transform the way healthcare is delivered in our schemes, and it's working. A call out here though, is the change that we're trying to make has not been done by an insurer before at such a large scale. So what we're doing is pioneering a change in our industry that's never been seen before. I'm pleased now to hand over to Cass from Honeysuckle Health, who will talk us through what we've been doing together.
Thanks, Sam, and hi everybody. First, I'm going to start off with a little bit about Honeysuckle Health that might be familiar to some of you, but not all of you. So Honeysuckle Health is a health services and specialist data science company, and our vision is to create better pathways to better health. We believe we can do this by creating a better connected healthcare system and improving health outcomes and better supporting people through their healthcare journey. We take a data science-led approach, which ensures that we can, 1, predict, and 2, help prevent poor outcomes for customers, as well as measure outcomes and values across the healthcare value chain for healthcare payers. Honeysuckle Health was built on 4 main principles, and I think importantly, this is for us where we see our partnership with QBE and the real alignment with them in the industry. 1, there needs to be investment in prevention and primary care. We believe there's an opportunity to invest more in primary care and preventative care to avoid the development and progression of chronic disease or injury into conditions that are requiring hospitalisation. We also believe that putting general practitioners at the centre of care delivery. We believe that both private and public healthcare funders must develop better relations with primary care providers and general practitioners in particular, because they really are the centre of someone's healthcare. We're really focused on value-based healthcare and accelerating that across all healthcare industry. We believe that incentives in the healthcare system must align with one, improving value, but also outcomes that really matter to patients. And as we mentioned, we are a specialist data science company, and we believe that we must use data science to inform decision making. Investments must be made to improve the individual's health, but that needs to be backed by evidence to ensure they're effective and appropriately directed to support that is sustainable, that supports a sustainable healthcare system in the future. If we and our partners that we work with can follow these principles, will lead to better health outcomes for individuals, communities, and reduce healthcare payer costs to ensure that Australia has a viable, high quality and affordable healthcare system. So Honeysuckle Health is a joint venture between NIB, an Australian private health insurer, and a global healthcare company, Cigna. And we work really closely with Cigna to understand global trends and evidence-based best practice models of care. And this enables us to develop models of care that drive value to both injured people, but personal injury schemes. Across the globe, alternate models of care have been adopted in personal injury schemes, which includes nurse-led or nurse case management services. These nurses working in nurse-led models of care undertake comprehensive assessments, provide timely person-centered care, opportunistic education and support, continuity of care, and link patients to other health professionals and services. These innovative and cost-effective nurse-led models of care aim to improve access to healthcare and give people choice, enhance the patient experience, and boost outcomes. As you can see on the screen, I've put some statistics there, but a US study with federal workers using nurse case management services significantly improved return to work outcomes and showed a 280% return on investment in medical and statutory benefits, equating to $3.5 million in US savings. Another study that we looked at in developing a model of care was injured people with lower back pain showed early nurse case management increased injured person satisfaction with their treatment plans and increased their odds of continual employment by 50%. Through our extensive review of best-in-class evidence-based return to work programs, combined with understanding and analysing both qualitative and quantitative information, we partnered with QBE to co-design our injury support program model of care. And I'll let Simone introduce you to our concept and our model of care using Nurse Joan.
Thanks, Cass. So I'd like to introduce you all to Nurse Joan. Picture yourself in hospital. You've just woken up from surgery and an experienced middle-aged nurse enters your room. She wraps you up in a big warm hug, makes you feel safe, cared for, and she's instantly earning your trust. But she's also going to be firm with you. She guides you through the necessary steps for your recovery and getting you back to your normal life. With Honeysuckle Health, we're connecting injured people with their very own Nurse Joan at the earliest opportunity to get things started on the right track. Nurses assist people in navigating the healthcare system and coordinating their medical requirements. They offer increased access to quality medical information, ensuring that appropriate healthcare practices are followed and addressing any gaps in care swiftly. They provide advice through regular phone calls and answer questions relating to healthcare. And they help the injured person to make informed decisions about their recovery. They're helping individuals access high quality healthcare, and they collaborate with the providers to ensure a seamless delivery of those services. Through close and regular engagement, they maximise adherence to evidence-based guidelines to optimise recovery outcomes. We're now going to show you a brief video when you hear from some of the nurses on the team.
Right, get you to jump to the next slide for me, Stephanie, if I could.
Sure.
And Julie was our first nurse, Joan, importantly. Julie's been working, so she's now our clinical operations manager and has been working with our team of 26 nurses, which are based all across Australia, supporting the communities that they work in. But what makes the injury support program different? So our program supports people in all aspects of their recovery with a key focus on healthcare. So using our data science capabilities, we've designed stratification algorithms to predict claims that are at risk of poor outcomes, and we tailor interventions to their severity. While we know medium-high complexity claims can benefit from healthcare navigation and healthcare coordination, there's an emerging risk for a category of claims that sits in the middle where historically insurers have taken a wait-and-see approach. We want to keep these people on track, monitoring their clinical progress against expected recovery timelines and address any variations, returning them to health or their new baseline health. We work closely with QBE and the injured person early in their journey. We know the longer it takes for them to receive evidence-based care, the more likely they are to experience poor overall outcomes. We provide holistic support as we know the primary injury isn't always the only driver impacting an injured person's return to health journey. We address pre-existing conditions, secondary psychological distress, and any social determinants of health that are affecting return to health and return to work outcomes. We act as coordinators and a central point for all members of their treating interdisciplinary team. Our nurses know how to engage with clinicians, when to push for accelerated access to healthcare, and how to address any deviations from evidence-based care. And importantly, our model of care promotes trusted therapeutic relationships between the injured person and their nurse coordinators. But it's all great that I can talk about it conceptually to you, but let me walk you through an example of how the injury support program is supporting, empowering and improving outcomes. So Mr. Rodriguez was worked in construction since he migrated from Chile when he was 18. He's 58 years old and he suffered a fall on the job site, resulting in an ankle fracture that failed to heal conservatively against evidence-based guidelines and eventually required surgery. So Mr. Rodriguez was at high risk of poor outcomes and was referred to our program 1 week after his surgery. Ensuring he returns to health and back to work is made even more important as he is the sole provider for his family. He has a wife and a teenage daughter who's finishing high school. Our first call with Mr. Rodriguez introduced him to the program, and we undertook a focused injury and medical assessment. We identified that Mr. Rodriguez was discharged with no follow-up instructions. He had clear signs of wound infection and after potentially seriously complications requiring immediate care. We referred him directly to emergency where he was treated for his life-threatening complications with his ankle surgery. We continue to support Mr. Rodriguez through his recovery period, extensively educating him on early signs of complications, providing close clinical monitoring and mental health support through connecting him to community resources. We coordinated care and appointments between his GP, his surgeon, physiotherapist, and worked with him on the concept of a return to work plan and helping him set expectations. Mr. Rodriguez returned to work on partial duties 2 months after entering the program. I guess despite the progress, he may not return to pre-injury duties, and he's working really closely with his employer to reskill so he can return to work full-time. Working with Mr. Rodriguez to understand his new baseline health and empowering him to assume an active role in his care has been integral in having him have the confidence to re-enter the workforce and continue to financially support his family. Mr. Rodriguez is only one of over 2,000 injured people. Oh, sorry, I might jump us back a slide. 2,000 people we've supported through the injury support program over the past 2 years. The injury support program is being delivered in 7 states and territories across Australia, and we've expanded the program to support both physical injuries and psychological injuries. Our nurses are based, as I mentioned before, in the communities they serve, which is important that they understand the local healthcare system. We're focused on access to timely treatment and have seen a 26% reduction in time to see a physiotherapist with less use of these services overall. Through the provider networks we manage, we work closely with treating clinicians to ensure adherence to evidence-based guidelines. And this has supported us in achieving 25% improvement in return to work timelines compared to standard ODG guidelines and resulting in 5 weeks less time off work after 12 months for injured people. The injury support program is person-centered and aims to build positive connections with injured people. With a net promoter score of +60 sitting in the excellent range, this highlights the impact the program is having on making the injured person's experience positive. No one wants to be injured at work or in a motor vehicle accident, but if they do, they want to feel supported and be shown genuine care and empathy. And these are only just some of the outcomes that we're sharing with you today. I'll hand back to Simone, who will be walking you through a little bit more around some financial outcomes and what we're looking at doing in the future.
Thanks, Cass. So yeah, we've obviously seen some fantastic health outcomes, and it's been a very key focus for us to make sure that the injured person is seeing the benefit of these programs. So these results that are coming through are really, really successful, and we're very confident in what the program's doing for those individuals that it's directly impacting. But from a financial perspective, we also needed to be seeing what was this going to be doing for the cost of our claims. And we're seeing substantial cost savings. So this graph demonstrates our closed claims costs comparing control and intervention groups at 12 months. So there's over 13,000 claims represented here, and this is across our 4 workers' compensation states. And we're seeing an average saving of 22% in the injury support program group, which is clearly showing to us that that early investment in quality healthcare provision is having a positive impact on the outcomes. And these savings for us are really important because it's giving us the opportunity to reinvest in innovation, which is crucial for us to maintain the momentum and keep pushing the needle forward. The program's success gives us confidence, and it's driving us to continue directing resources into further innovation in healthcare. We're committed to delivering value for our customers, and we're very committed to contributing to a positive change in our industry. So whilst we're really proud of the progress we have seen so far with our injury support program, I'll bring us back to the healthcare problems that we touched on at the beginning, because we have to acknowledge that we've still got a lot more work to do with solving these complex healthcare issues in our scheme. The injury support program has been a very successful first step, and as I mentioned, it's really been that individual healthcare experience approach that we've been trying to influence, and we're very pleased with how that's going. But if we want to see widespread industry change, we need to do more. So this is bringing us to what we're working on next. We're actually exploring a new way of approaching these broader issues of pricing volatility and poor healthcare delivery that we're seeing across the industry. Historically, we've experienced challenges with tackling these issues, and particularly at scale, because we've had limited bargaining power to be able to negotiate or achieve competitive costs, particularly in our unregulated schemes. And we've also lacked the right capability or resources to be able to compare the value of healthcare services and the impact that that has on outcomes. A strong example of this is in private hospitals. So we have quite limited payment structures and controls in that space. It's well known that workers' compensation insurers are paying more than would be paid by private health insurers for equivalent services. And Honeysuckle Health is currently the only ACCC authorised buying group for health service contracting external to private health funds, with the experience and capability to help us do this. So with them, we're broadening out access to networks, pricing and quality medical information, which has significant potential for our customers and for the community. What does this all really mean? Well, for customers, this is going to give access to consistent and competitive pricing for healthcare services. For injured people, it will give priority access to treatment and provide confidence in the quality of the healthcare that's being provided. For our claims and our community, it's going to give transparency over outcomes and lift accountability for the delivery of healthcare in our schemes. We've all seen too many scenarios where healthcare delivery in our schemes has failed, and it's time for that to change. A final call out here is that whilst we've shared with you these broader concepts and what we're working on, these are complex problems to solve, and we're still working through the detail around practical application. But we're excited to be partnering with Honeysuckle, and with the progress that we've seen so far and the direction that we think we're going, we really feel like this is a valuable step forward, and we look forward to being able to share more outcomes with you as we progress on this journey. So thank you.
No, we'll throw it over to the floor for any questions. I know Stephanie is moderating any questions that we have coming through.
No, thank you very much, Simone and Cass, for your presentation. And as has just been mentioned, if anyone does have any questions for today's presenters, Simone Guys from QBE and Cass Frey from Honeysuckle Health, please use the questions window on your control panel to type and submit those questions for response. Today's webinar is also part of WorkSafe Tasmania month. WorkSafe month runs until the end of October. Please visit worksafe.tas.gov.au to see what other events we have running throughout the month of October. Simone and Cass, will the video be made available to participants?
Yes, it will, off the back of the webinar. So I know it'll be sent over to participants as well as made available on the WorkSafe Tasmania page.
All right, good-o.
Is that in reference to the recording of this session, or that this honeysuckle video? Because that's already available, I believe, isn't it, Cass?
Yes, it is on the Honeysuckle Health website and on the Honeysuckle Health YouTube page. And we can share a link if that's helpful with the audience off the back of the session today.
All right, thank you. And then, yes, as mentioned, today's webinar has been recorded and will be available on WorkSafe Tasmania's YouTube page. Is the ISP likely to be adopted nationally, or at this stage only through QBE?
So we're working at the moment with some other personal injury scheme providers and insurers to roll out the program. We're hoping that it will be rolled out across some of the other states and schemes very shortly.
Thank you. We don't appear to have any other questions coming through at the moment, Simone and Cass. Are there any key messages that you would like to leave attendees with?
Would you like to go first, Cass?
I can go first. And my key message is around, I guess, innovation in healthcare as well. We see far too often that innovation in healthcare is seen to be technology focused, but innovation can mean a lot of different things. And I guess that's what we're trying to do from a Honeysuckle Health perspective, and in partnership with QBE, with one, the injury support program, but two, looking at different models of care and trying to innovate to create change. And then two, within the buying group and the work that we're doing around providers, we really want to make sure that there is alignment in terms of incentives for patients, injured people, the provider community, healthcare payers, because we really want to make sure that we're creating a better connected healthcare system and putting the injured person at the centre of the journey and that focus is key for us. So making sure that they have that really positive experience, because we know that if we're turning them to health, we know that they're going to return to work and they're going to be better back in the community and back working.
Yeah, I completely agree, Cass. And probably just to add to that from an insurance perspective and my own personal view too, that this piece of work and what we've been using the healthcare innovation process to do is, we touched on that as being directly involved. And I think as an insurance company in the past, we've been passive in that process. We've almost shied away from being directly involved in people's care because we've been quite conscious of that injured person choice aspect. And we certainly want to keep maintaining that. We really value that injured people feeling empowered and being informed about their choices is important. But, you know, from our research and what we were seeing is that choice and informed choice were quite different. And being able to facilitate, you know, the exchange of appropriate information and helping somebody feel like they really understand the decisions that they're making and they can connect really well with their healthcare experience. You know, the role that we play in helping to connect them to that kind of experience is incredibly valuable. And I think we have an obligation to do that for these people. So the fact that we're seeing the progress that we have to date is really comforting. And you know, I've got always mentioned at the beginning a passion for helping people, and I feel like we're genuinely doing that. But I guess the other exciting part is that we know that these issues can't be solved quickly, they're complex, but to be really successful, we do have to do it at scale. And I think the opportunity that Honeysuckle is helping us to tackle is to be able to really actually do that at scale and make a big difference for not just the injured people we support, but hopefully a broader community and industry change into the future. Just think we can do things better, so we've got an opportunity to try, and yeah, I'm really pleased to be part of that journey.
Thank you very much, Simone Guys from QBE and Cass Frey from Honeysuckle Health for your webinar today, Healthcare in Workers' Compensation. And thank you to everyone for attending today's webinar as well. As mentioned, today's webinar is part of WorkSafe Tasmania month, which is run throughout the month of October. Please do head to worksafe.tas.gov.au to find out what else is happening in your area or online throughout October. Thank you again to our presenters, and thank you everyone for attending.
Thank you.
Thanks, everyone.